Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on lower limb. Now, before I start this presentation lecture, I would like to tell you a few things regarding this lecture. First of all, as you know, in our lower limb, there are 30 bones. Now, amongst these 30 bones, in this lecture, I am going to discuss with you the femur bone, and then I will discuss the tela bone, and the remaining 28 bones of our lower limb I will explain you in my next lecture. Because the reason is, if we discuss all this 30 bone in one lecture, then the length of the lecture will be increasing, and you and me, both of us, will get tired. Okay, so that's why over here we are first discussing the femur, and then we will discuss the tela. Now, first point, that is the femur. Now, how many bones are there in our lower limb? So we are having two lower limb. Okay, in normal day-to-day life, we know this lower limb. Many a times we call it as our leg. Okay, so but in biology, it is lower limb. So in each lower limb there are 30 bones, and this 30 bones, they are located in four locations in our body. The femur bone is present in our thigh. For example, in this figure, this is our thigh, and inside the thigh, these two, in both the thighs, the femur are present. So this is the first point regarding the femur. Femur is present in the thigh. Then there is one tela, and it is present at our knee joint. So this is the tela. One tela is there. Then in our leg, two bones are there, tibia and fibula. This one is the tibia, this one is the fibula. Then in our ankle, 7 tarsal bones are there. This is the ankle region. So in the ankle there are 7 bones, and these bones are known as the tarsals. Then the foot region of our leg. So in that, 5 metatarsals are present, and the fingers of our feet are known as the phalanges. So there are 14 phalanges, phalangeal bone, or the bones of digit, are present. So these are the 14 bone in our digit of our feet. Okay, so 14 phalanges. Now, so with this we have completed 1, 2, 3 and 4 points. Now moving on the fifth point. Now femur. First of all, you observe the femur. This entire bone is the femur. Skeleton of thigh, femur. The femur, also known as the thigh bone, and this thigh bone is the longest, heaviest and strongest bone in our body. So this is the first point for the femur. Longest, heaviest and strongest bone of the body. Moving on the sixth point. Now the proximal end of the femur, it articulates with the acetabulum of the hip joint. For example, over here in this figure, this is the head of femur and this one is the acetabulum. So this head fits into acetabulum, and acetabulum is the part of the hip bone. Okay, so this is the sixth point, and over here you will get the clear idea in this figure. For example, the head of femur, and it is articulating with the acetabulum of the hip bone. Okay, so this was the sixth point of our discussion. The head articulates with the acetabulum of the hip bone. Now moving on the seventh point of our discussion. Now the distal end, for example, this one is the femur, and this is the distal end. Right now that I am showing you, the blue line that I am drawing, this is the distal end of the femur, and as you can see, it is articulating with the tibia and tella. I am zooming so that you can see it properly. This is the distal end, and as you can see, this one is the tibia and this one is the tella. So distal end of femur articulate with the tibia and tella. Seventh point. Now moving on the eighth point of our discussion. Now eighth point is regarding the hip joint, also known as the coxal joint. Now what is this hip joint or the coxal joint? So as you can see over here, the head of the femur, and this one is the acetabulum of the hip bone. So head fits into acetabulum of the hip bone, and the joint which is made, or the articulation which is formed between the head of femur and acetabulum, this joint is known as the hip joint or the coxal joint. So this is the eighth point of our discussion regarding the hip joint or the coxal joint. And here this photograph, this figure is actually the radiograph or the X-ray of the hip joint. Now moving on the ninth point. Now in the ninth point, as you can see, this is the head of the femur, and in the center of the head there is a small central depression or pit is present. Okay, so as you can see, this one is the small central depression or the pit. So this small central depression or pit is known as Fovea Capitis. So this is the Fovea Capitis. And what is the function of Fovea Capitis? Now here you need to understand that, let me draw this. This is the acetabulum, for example, and from Fovea Capitis, what happens? The ligament. Right now I am drawing the ligament. So ligament is present between the acetabulum and the Fovea Capitis. So this ligament is actually joining the acetabulum and the head of the femur. So this Fovea Capitis is providing the attachment surface for the ligament. With the figure you will understand this thing. I am showing you this one figure is there, so you will get the idea. For example, see this ligament and this ligament. and you follow the arrow, then you will find this ligament of head of femur. So these two are not actually the different ligament, they are actually the same ligament, but since this head right now they have detached from the acetabulum, so that's why this cut ligament, if you observe closely, so you can see the cut ligament. Okay, so when we fit, now if we fit this head over here, so this is the single ligament, it is not cut. That's why that's how you need to understand this thing. Okay, so in the ninth point, the central depression or the pit, that is fovea capitis, and this fovea capitis is providing the attachment surface for the ligament, and this ligament joins acetabulum and the head of the femur. That is the meaning of this point number 9. Now moving on the point number 10. Now first of all, this part, this is the head of femur. This part is known as the body or the shaft. Now where the neck is present, so the neck of the femur is the constricted region distal to the head. This is the head, this one is the head, and this constricted region which is away, which is posterior, which is behind, which is distal, which is constricted, this region is known as the neck. So in the 10 point is regarding the neck, and neck is the constricted region present distally to the head. 10th point. Now point number 11. Now first of all, in point number 11, there are two names. This is the theory point: greater trochanter and the lesser trochanter. Now what are these greater and lesser trochanter? So these are the projection from the junction of the neck and shaft. So these two are the projection, and where they are present, at the junction of neck and shaft. This is the neck, this one is the shaft. So this part is the junction between neck and shaft, and here as you can see, this projection, okay, slightly bulge out area, and this bulge out area. So these two projections are known as the greater trochanter, and this one is the lesser trochanter. Now what this trochanter are doing, what they are meant for? So they serve as the point of attachment for the tendon of some of the thigh and buttock muscle. Okay, so greater trochanter and lesser trochanter provide attachment for tendons of thigh and buttock muscles. Now the greater trochanter is the bulge out area or the prominence or the process which can easily felt or which is easily visible. We can easily see this greater trochanter from the anterior to the hollow and on the side of the hip. So on the side of the hip, this trochanter, this greater trochanter is easily visible, and we can easily feel this greater trochanter on the side of the hip. So this is the greater, and so point number 11 is regarding the greater and lesser trochanter. Now moving on the 12th point of our discussion. Now first of all, this is the distal part, okay, and distal part of the femur, and as you can see the distal end is expanded, okay. So here this is the expanded distal end of the femur. This one is the expanded distal end of the femur, and in this expanded distal end of the femur, medial condyle is present. For example, this one is the medial condyle, okay, and this medial condyle is also known as the knuckle, and lateral condyle is also present. So this one is the lateral condyle. So first this two name, medial condyle, lateral condyle, and what these condyles are doing. So these condyles are articulating with the medial and lateral condyle of the tibia. Once again, this is very easy. This one is the medial condyle of the femur. This one is the lateral condyle of femur. This one is this part. This is the medial condyle of tibia. So this medial condyle of femur, it is articulating with the medial condyle of tibia, and this is the lateral condyle, okay, and it is articulating with the lateral condyle of the tibia. So this is the lateral condyle of the tibia. Here in this figure the name is not written, so I will show you one more figure. For example, over here this is the figure of tibia and fibula, and in this figure this is the medial condyle, lateral condyle, okay. There. So a very simple point, okay. Medial condyle articulate with the medial condyle of tibia, lateral condyle of femur articulate with the lateral condyle of tibia, okay. So this is the point number 12, and this is the figure, okay. And this figure, right knee in flexion, anterior view. So I will show you this entire figure, and this is also right knee in extension and in posterior view, this one. So here also you will find this condyle, medial. For example, over here medial condyle is shown, and this one is the lateral condyle, okay. Then medial condyle of tibia, okay. So point number 12 is related to the condyles. Now moving on the point number 13. Now point number 13 is like this. Now superior to the condyles, for example this one, this one is the medial condyle, this one is the lateral condyle. So superior to lateral condyle, what is present? Lateral epicondyle is present, and superior to medial condyle, medial epicondyle is present. So point number 13 says superior to condyles are the medial epicondyle and the lateral epicondyle. And to this epicondyle, that is the medial and lateral epicondyle, ligament of the knee joint attach. So with this the ligament joint, and with this the ligament joint, okay, for the knee joint. So point number 13, okay, lateral epicondyle and medial epicondyle. Now moving on, point number 14. Now between this, see, this is the medial condyle, this one is the medial condyle, this one is the lateral condyle. In between these two condyle, as you can see, there is a depression, and this depression is known as intercondylar fossa. So here intercondylar fossa is shown. So this one is the intercondylar fossa. So point number 14 is the something related with the depression which is present between the medial condyle, and this depression is known as the intercondylar fossa. Now moving on to point number 15. Now in point number 15 we are trying to understand the position of tela, where exactly the tela is located. Now here in this, the theory point says that the talar surface is located between the condyles of the anterior surface. For example, in this figure, this part, this is the medial condyle, and this one lateral condyle, and this is the tela. So tela, the margin of the tela, as you can see, it is covering the medial condyle and lateral condyle, or we can say the margin or the border of the tela is present on the some part of the medial condyle, and it is also covering some part of the lateral condyle. So point number 15 is the position of the tela, okay, where it is present, the tela is. Now point number 16. Now abductor tubercle. Now where this abductor tubercle is present? Superior to the medial epicondyle. First of all, where is medial epicondyle? This one, this part is the medial epicondyle, and superior to that a rough projection is present. So this rough projection is known as the abductor tubercle. And what this abductor tubercle is doing? So it is providing a site of attachment for the abductor magnus muscle, okay. So abductor magnus muscle joins over here, that is the abductor tubercle. So this is the point number 16. Now moving on the point number 17. Now with this we have completed the discussion of femur. Now I am discussing with you the tela. Now as you can see, the title, skeleton of the thigh tela. Okay, first you observe the position of the tela, where exactly the tela is present and what is the shape of the tela. Now the tela means little disc or the knee cap. Now as you can see, the tela is small and the shape is the triangular shape. So tela is a small triangular bone, and where it is present, located anterior to the knee joint. So this is our knee joint, and this one is also a knee joint. So anterior to it, the tela is present. So this is the point number 17. Now moving on, point number 18. Now the broad proximal end of the tela is known as the base. For example, this part, broad proximal end, that is known as the base of the tela, and the other name for the tela is the sesamoid bone. Okay, now this base, where it is developing, so it develops in the tendon of the quadriceps femoris muscle. Base develops in the tendon of the quadriceps femoris muscle. Okay, so this is point number 18 regarding the base of the tela. Now point number 19 is regarding the apex. Now what is apex? Pointed distal end. For example, this one, this is the pointed distal end, this one in the anterior view, this one is the posterior view. So the pointed distal end is referred as the apex. So here the apex is shown, here the apex is shown. So these are the apex. Now point number 20. Now this is the anterior view. This one is the posterior view. So in the posterior view, as you can see, two facets are present. For example, this one is the facet and this one is the facet. So both the facet are known as the articular facet. This one is also articular facet, and this facet, they join with the medial femoral condyle, and this articular facet is covering the lateral femoral condyle. Okay, so on the posterior surface of the tela there are two facets, and they are present on, one is present on the medial femoral condyle and another one is covering the lateral femoral condyle. So this is the point number 20. Now moving on the point number 21. Now first of all, as you can see, these are the two names. One is tela, another name is the tibial tuberosity. Now this part, this projection, this bulge out area is known as the tibial tuberosity, and this is the tela. Now in between the tela and tibial tuberosity, the ligaments are present. So these are the ligament. Okay, and this ligament are known as the talar ligament. So we can say the talar ligament, they are attaching, or they are making the connection, or they are joining the tela and the tibial tuberosity. That is the meaning of this point number 21. Now point number 22. Now point number 22 is regarding the talofemoral joint. Now where this joint is present? So between the posterior surface of the tala, let me show you. This is the tala. This is the posterior surface of the tala, and talar surface of the femur. So this one is the femur and this one is the talar surface of the femur. So this one is the talar surface of femur and this one is the posterior surface of tala. So in between these two surfaces, this joint is present, and this joint is known as the talofemoral joint. Okay, and this talofemoral joint is the intermediate component of the knee joint or the tibiofemoral joint. So it is also, so this joint is the part of the knee joint. That is the meaning of this point. And one more figure is there for this talofemoral joint. For example, tala femur. So this joint between tala and femur, this is talofemoral joint. So point number 22 was something related to talofemoral joint. Now moving on the last point of this presentation lecture. Now this point is the functions of tala. What the tala is doing. Now the tala increase the leverage of the tendon of the quadriceps femoris muscle. The name, once again, the name of the muscle, quadriceps femoris muscle, and the tendon of this muscle. And what the tala is doing, so it is increasing the leverage of the tendon. So basically it is providing the surface, okay, and with this surface of tala, then tendon of femoris muscle attach. Okay, so this tendon can easily move, it can easily rotate when this tendon is using the tala as a surface. Okay, then the tala also maintains the position of the tendon when our knee is bent or our knee is flexed. Then the tala also protects the knee joint. Now before I wind up this presentation lecture, I would like to show you some of the figures. If you are interested, you can go through this figure. So in this figure you will get the idea of some of the muscle and ligament of our knee joint, and here also the knee is shown and some muscles and tendons and ligaments are shown. This is also a good figure, knee joint. Okay, then this is the knee interior view from inside. Superior view, then this view. Then osteology of knee. All the names, you need to remember all the names. Okay, all the names. So with this, I have completed this presentation lecture on lower limb. Okay, so one part we have finished. The next part I will discuss in the next lecture. I hope you have enjoyed this presentation lecture, and at the same time I hope that this presentation lecture will be helpful in your exam preparation and in your studies. My name is Manish Kosti sir. I am from Ahmedabad, India. Bye bye. Namaste.